Hello, everyone. My name is Tyron Nixon, and I'm the Transformation Implementation Manager within the Medicaid's Program Division at the Washington State Healthcare Authority. We've known for a while that there are gaps in services for those that are leaving incarceration or justice involved platforms. What we know is that people had to reapply for Apple Health or Medicaid here in Washington State. They had to reapply for Apple Health coverage after release because their coverage was terminated. It was not suspended. That process took a while to show a person as eligible for Medicaid coverage. So during their most vulnerable at-risk time, released individuals could not receive that necessary medication, equipment, or treatments. Reentry initiatives exist to help people successfully transition back into the community after incarceration, with the goal of just reducing recidivism and improving public safety. Those were some of Washington's goals. We achieved this by providing critical support services such as job training, housing assistance, mental health and substance use treatment, and life skills education, a variety of those things. And actions to reduce recidivism, improve public safety, and enhance health outcomes. What does that mean? Within 90 days of release, the objective is to facilitate access to essential healthcare services and case management to enrollees while incarcerated and allow beneficiaries to establish relationships with community-based providers from whom they can receive services upon reentry to the community. Those pre-release services are going to include care coordination to diagnose, treat, stabilize individuals, to address service gaps that might exist in correctional care facilities. It's going to provide treatment to control qualifying conditions, for example, medication changes, and prepare those coming back into the community, prepare them for release, including providing behavioral health clinical consultation services that's focused on mental health. Also, there's going to be medication-assisted treatment pre-release. So medications for alcohol and opioid use disorder, hepatitis C, HIV is going to be available. I want to say the Reentry Initiative in Washington State has been developing for many years. I will start with leadership direction in terms of Washington's legislature, both chambers passing important legislation, and the governor's direction. What we did is we launched a robust capacity building program that required facilities to describe their existing capabilities. Operationally, what do you look like? So we wanted to know those operational gaps and technical assistance needs. We used a cohort selection and milestone approach where we were able to distribute funding to facilities to support their planning efforts to participate in the initiative. We have 8 facilities that went live on July 1 of 2025. We have 4 more facilities that will launch November 1st. There are 11 more facilities making progress for starting on January 1st of 2026. There are 23 facilities intended to participate in cohort number 3, which is going to launch July 1 of 2026. So overall, a mix of jails, prisons, justice or juvenile justice, juvenile detention and tribal facilities. A total of over about 56 facilities have submitted their intent to participate in the initiative. We were really building a safety net. We knew about the science of policing and incarceration is about public safety, but putting all of that aside, remembering that why are you doing this? It was about the people. It was about how people are going to receive the help that they need to be successful as they move back into their communities.